everyone. Now today's a topic of emergency radiology, very important, that is fast and e-fast. I am Dr. Aanchal Bhayana and I have done my MD radiology from Safdarjung, Delhi. So let us start with this important topic of fast and e-fast. I'll give you some questions and let us see if you know them, what will be your answers for them. A 21-year-old patient had road traffic accident with history of blunt trauma to the abdomen. These are the clinching features. There is a blunt trauma to the abdominal region, following which his BP was 120/88, pulse was 100. Which of the following is the initial screening investigation in such a scenario? What are the question scenario that is given to you? Question is, first, there is a blunt trauma. So there is a blunt trauma to the abdomen, and following which BP is 120/88, pulse is normal. So do you think the patient's vitals are stable or unstable? The patient's vitals are stable, okay. The patient's vitals are stable. In this case, what is your initial screening investigation? Remember, it is fast. Fast is nothing else but an ultrasound of the abdomen that you quickly do in the emergency setting to look for any free fluid in the abdomen. So fast is nothing else but an ultrasound only, and that is basically to see for any free fluid in the abdominal cavity, which is in the setting of trauma said to be an indirect evidence of hemoperitoneum. Okay. So earlier we used to do diagnostic peritoneal lavage and all. Nowadays it's not done. Fast is nothing else but an ultrasound only, which is a non-invasive thing. In the emergency setting it is available. Look for any free fluid, and if it is present, it indicates it's hemoperitoneum. So if the patient has come with blunt trauma abdomen, the initial investigation is fast and the patient is stable. Clear? Now see the question. Same question I've given to you, blunt trauma abdomen. Now the BP of the patient is 50/38, pulse is 170. What do you think? The patient is of a case of blunt trauma abdomen, but the vitals now are unstable. The patient is unstable. What will be again your initial screening investigation? Remember, the initial screening investigation in any blunt trauma abdomen, if the patient is stable or unstable, you have to do fast, because fast, as I'm telling you, is just an ultrasound of the abdomen, easily available in emergency setting, very quick study, and you can pick up if there is any free fluid present or not, which can indicate if there is hemoperitoneum or not. Repeatedly I'm saying this, so clear? So answer again here is fast. Now the question is changed. The patient has blunt trauma to the abdomen after RTA, BP 50/38, pulse 170, means the patient is a case of blunt trauma understood to the abdomen. This is an abdominal blunt trauma, but the patient is unstable. The patient is unstable. Fast scan was positive. What was the initial test? I'm telling you, initial test you always do is fast. Fast has come out to be positive, means on fast scan, on ultrasound, you have found free fluid, means there is some hemoperitoneum present. What will you do in this case? Patient is unstable. You cannot waste your time in doing CT scan and taking the patient for CT and shifting and getting CT scan done. You know there is some hemoperitoneum going on, the patient's vitals are unstable, immediately rush the patient to OT and do laparotomy. So this is a management in a case of blunt trauma abdomen who is unstable and fast is positive. Okay. Same if the patient has blunt trauma abdomen but the vitals are stable. In this case, if in a stable patient the fast has come out to be positive, means there is some hemoperitoneum, there is free fluid. Now from where the hemoperitoneum is occurring, you have the time and the patient is stable, you can shift the patient to CT scan, get a contrast enhanced CT scan of the abdomen done to find out what is the source of hemoperitoneum. Is it a solid organ injury coming from liver or spleen or kidney? What is the source of injury? So now in the stable patients you can do the CECT abdomen. So understanding with the protocol. So FAST is focused assessment with the sonography for trauma. This is very important full form of FAST, and this is an initial investigation in a case of blunt trauma in the abdomen for suspected internal organ injury. FAST is nothing else but it is an ultrasound. So they can ask you, FAST involves ionizing radiation or non-ionizing? We know that ultrasound involves non-ionizing radiation. So FAST is nothing else but an ultrasound of the abdomen. So what is important points? Any patient who is coming with blunt trauma abdomen, whether the patient's vitals are stable or unstable, the initial investigation that you will do is FAST. If the FAST is positive and the patient is stable, you can do a CCT of the abdomen and find out the cause of hemoperitoneum. If the patient's FAST is positive and a patient is unstable, then you have to immediately shift the patient to the OT for laparotomy. Clear with this basic funda of FAST, okay? So we'll take a 2 minutes break and we'll continue from here.